Good morning and welcome to Health on Traxx with me, Anna. Now, cervical cancer is currently the sixth most common cancer among women in Malaysia, and what many people may not realize is that it's almost always caused by a virus called HPV, the human papilloma virus, right? So the good news is cervical cancer is one of the most preventable cancers, and vaccination plays a huge role in that. So to complement the government's national HPV vaccination program, the National Cancer Society Malaysia has launched the Leaving No One Behind initiative aimed at reducing HPV-related cancers, and now with Lnob 2.0, HPV vaccination is available for both girls and boys aged 9 to 40. Now joining us today is Dato Dr. Saunthari Somasundaram, President of the National Cancer Society Malaysia, and she's going to help us understand HPV, cervical cancer prevention, and why early vaccination matters. Doctor, welcome to the show.
Thanks, Anna.
Yes.
Happy to be here.
Yay, happy to have you here as well. Now, we are currently live on Facebook and TikTok at TRAXXfm Official. So if you have any questions, feel free to post it over there. Now, doctor, let's start with the basics, right?
Okay.
Because HPV is something we hear about often, but not everyone fully understands about it. Can you briefly explain what is HPV, the types of cancers it can cause in both males and females, and how the HPV vaccine works?
Okay. So, as you mentioned, HPV stands for human papillomavirus. It's a common infection in sexually active individuals. And it can affect both men and women. It's a contact virus, so it's a skin-to-skin contact virus. There are over 200 subtypes of HPV,
Wow.
which have been identified. It's a huge number. But what you have to understand is there's only about 15 which is considered to be high risk. HPV is just as common as the common flu, as we talk about. And like the common flu, you can get HPV and the body immune system can resolve it by itself.
Okay.
So you can get HPV, it disappears, it comes back,
okay.
etc., depending on your sexual activity. But what happens with persistent HPV is that it can lead to more serious infection. And that takes time. It
Okay.
can take up to 10, 15 years before you get more serious infections, and then you can get cancers as well.
Wow.
So the types of cancers that we look at in terms of, which are related to HPV are, of course, as you mentioned, cancer of the cervix. But the more uncommon ones that you can see are cancer of the vulva, vagina, for men, the penis, anus, nasopharyngeal and oropharyngeal, which is your throat cancers as well. In terms of vaccination, like other vaccinations, like your influenza vaccination, we have HPV vaccinations as well. And these HPV vaccinations are to stop or to prevent you from getting those persistent infections which can lead on to cancer. So there are different types of HPV vaccinations. The latest is what we call a nano, which means that it covers over nine
okay.
specific subtypes of the HPV, which cause up to 99% of cervical cancer.
Oh, wow. Now, there's something I was a bit shocked by, which is like we think all this like HPV things mostly is for girls. But funny enough, it's a common misconception, right, that HPV only affects girls. And why is it important to recognize that boys can also contract, carry, and transmit HPV?
Well, as you mentioned, it's both in girls. And basically, the virus is gender neutral. It doesn't care whether you're a boy or girl.
Okay.
You can get infected. The issue that we face is that because HPV symptoms are generally non-existent, for most people, they don't have any symptoms at all, that you don't realize that you're infected. It's when you have those persistent infections that you get those symptoms which are there. Why it's important that we recognize that it's boys and girls is that it means then you can pass it on to someone without even realizing that you're doing so. And it's a sexually transmitted disease, so it doesn't matter whether it's protected or unprotected sex, meaning a condom, yes, can decrease your risk.
But that doesn't mean it's not all...
It's not 100%.
Yeah.
So it's important to note that as well. For women, yes, it leads on to cervical cancer and other cancers. But a lot of people don't realize that HPV also causes cancers in men.
Okay.
So it's important for men, for their own health, to also recognize that HPV can be dangerous.
Yes, can be dangerous. And why can boys and men have HPV without symptoms, unknowingly passing it on to others?
Because that's the nature of HPV.
Okay.
That it takes a long time for symptoms to occur. The issue with HPV is that it's a contact virus. So it likes sitting on the
Dormant,
skin,
okay.
dormant on the
Alright,
skin
okay.
or mucus areas. And because of that, you don't get symptoms straight away. It doesn't get into your blood immediately, and then you get, the fever, that you generally recognize with other infections, the body aches, the fever, etc., etc. It sits there for a long time, and it might cause local infections, meaning that you might have a little bit of symptoms on the local, around the skin area, your genitalia, etc. But again, things like that you don't realize. It could be a little bit of discharge, it could be a little bit of pain, but it's not something which is overtly out there.
Yeah, it's not as hard. It's not cancer yet, right?
No, it takes a long time for it to become cancer. And when you have the flu, you get the runny nose, you get the fever, you get so it's in your face to a certain extent.
Yes.
With HPV, it's a little bit more insidious.
Okay.
It doesn't have that in your face
kind of a thing.
symptoms
Yeah.
that you recognize with other viruses.
I understand. Now we are speaking with Dato Dr. Saunthari Somasundaram, President of the National Cancer Society Malaysia, about HPV, cervical cancer, and why vaccination matters for both girls and boys. Okay, we will be right back after this short break. Welcome back to Health on Tracks with me, Anna, and today I am joined by Dato Dr. Saunthari Somasundaram, President of the National Cancer Society Malaysia, and our topic today is Leaving No One Behind, which is the government's national HPV vaccination program. Okay, now, Doctor, one of the biggest misconceptions out there is that HPV is only for as a girl's issue, like we mentioned just now, simply because cervical cancer affects women, but HPV itself doesn't discriminate, right? Now, why is it important for boys to be vaccinated against HPV even though cervical cancer affects women?
Okay, and as you mentioned, it affects both men and women. And yes, cervical cancer only affects women, but HPV can cause other serious cancers in men, especially penile cancers, cancers of the throat, anus, etc. So by vaccinating both boys and girls, you're being gender neutral about it. One, you're protecting the boys themselves, but secondary is that you're protecting the girls by vaccinating the boys, because it helps reduce helps reduce the spread of HPV in the community. It promotes that whole idea of herd immunity. The more people that you vaccinate, the less amount of HPV virus is going to be circulating. So it's really, really important that we actually protect everyone that we can. Yes, a lot of people will say there's a school vaccination program. There's a national vaccination program for girls, so why do we have to bother about the boys? But the vaccination program, the national vaccination program for girls, only covers those who are going to school as well.
Yes, you're right.
It doesn't cover everyone. So there are girls out there who are not vaccinated. So by vaccinating boys, you're actually protecting the wider population.
You're reaching the places where we have not reached in the first place, right?
Exactly.
And will vaccinating boys help reduce cervical cancer rates, and how does it contribute to broader HPV prevention? I believe you mentioned a bit of it. Maybe you can expand more?
So definitely it helps reduce cervical cancer rates. And we know that because one of the countries that vaccinates both girls and boys is Australia. And we've seen a drop in the number of persistent HPV infections in both girls and boys in Australia. And I think in 2023, if I'm correct, for the first time ever, there was no HPV-related cervical cancer in the ages of 20 to 25.
Wow, okay.
So it makes a difference. It makes a huge impact if you are able to vaccinate both girls and boys when it comes to cervical cancer. But again, it's important that we recognize that we have to also protect our boys.
Yes, definitely. Doctor, I know this is not part of the question, but I just thought about it. How early can someone contract cervical cancer?
As long as you're sexually active.
Okay.
You can get
so that's
cancer.
A bit crazy.
Exactly.
Yeah, so that's why the vaccination happens from 9 to 14.
Yep.
Okay.
It's very important to get vaccinated before you're exposed.
To anything, right?
To anything. And the way you get exposed to HPV is through sexual intercourse.
Yes.
So it's to catch someone, whether you're a girl or boy, before you actually start sexual intercourse. That's one. Two is also that in terms of the immune system, building up the immunity from the vaccination, you actually have a gretter boost in terms of immunity when you vaccinate them younger.
I understand.
So it's really important to do it between those ages of 9 and 14 because you'll get the maximum potential of immunity.
I see. Now, can you also briefly explain the Leaving No One Behind LNOB initiative and why expanding HPV vaccination to include boys is a key part of this effort?
Okay. So last year, we started this Leaving No One Behind LNOB. That's a mouthful sometimes. Program. We were given the opportunity to do this public health initiative in 2023, 2024. And basically it was to mop up those who hadn't been vaccinated. And it was directed primarily at girls. Because, during COVID, etc., a lot of girls didn't get their vaccinations.
Yeah.
And as we mentioned before, those who weren't in school, those who are unable to get vaccinated, marginalized community, underserved communities, refugees, etc., we wanted to ensure that we could vaccinate as many people as we could. So it was targeted towards girls, but we did boys as well. And with collaborations with other stakeholders, civil society organization, community leaders, schools, local councils, private healthcare, etc., we actually did in 1 year, and this is amazing, and it's internationally recognized. We did 1 year just under 300,000 vaccinations.
Oh, wow. That's a big number.
It's a huge number if you think
yeah.
about it being done by a non-profit organization with assistance from all the stakeholders. It was the community coming together, and I think that's what made the difference, and we have to recognize that and applaud that the whole community came together to do this. And it wasn't just, everybody says, oh, you just did it in KL, but we didn't. We did it in all 16 states and federal territories, and we did it in 141 districts.
Wow.
So yes, they went out on boats. They went out on ships. They went out everywhere, basically, to do the vaccinations. And that really covered a lot of Malaysians who didn't have the opportunity to get vaccinated previously.
Exactly. Now, doctor, before we go for a break, I have a question, and there's also a question from TikTok. But before that, I want to ask my question first, which is how long... I may not know this, maybe others know this, but I'm just asking out of curiosity, right? When someone is vaccinated, is there a time frame of for the thing to stop working or something like that?
No, it's a lifetime vaccination.
It's a lifetime vaccination. It's a one-time thing.
It's a one-time thing. The only issue I would put here is that when the vaccinations first came out, so a lot of people, including my daughter, got vaccinated when it first came out. It only covered 4 different subtypes, or 2 or 4 different subtypes. So the school program covers only 2 subtypes. The ones outside cover 4 subtypes. So when it first came out, that's what it covered. Now, remember I told you there's about 15 subtypes.
Yes.
Okay, so it doesn't cover
everything.
everything. So the first couple of vaccines that came out covers about 70% of the high risk, or 70% of cervical cancer, as we say. The newest one covers it covers 9 subtypes, which covers about 99% of all cervical cancer. So if you get the newer ones, then yes, there's greater coverage. So for those who had the earlier ones, where you have about 70% coverage, I would say if you want to get the extended,
you can
go ahead. Talk to your GP about it, about how to go about it.
All right. One more question before we go for a break. Someone on TikTok asked this question: is HPV like herpes?
Okay, herpes is also a sexually transmitted disease. Herpes causes warts, ulcers, etc.
Okay.
So there is similarity because HPV also causes warts and ulcers, etc. However, HPV is more dangerous in the sense that it causes cancer. So that's the difference. HPV can cause cancer.
I see. Now let's go in for a quick break. We are talking to Dato Dr. Saunthari Somasundaram, President of the National Cancer Society Malaysia. And when we come back, we'll talk more about the government initiative, which is leaving no one behind. So let's go in for a quick break. Good morning and welcome to Health on Traxx with me, Anna. With me is Dr. Saunthari Somasundaram, Dato Dr. Saunthari Somasundaram, President of the National Cancer Society Malaysia, and we are talking about the government's national HPV vaccination program called Leaving No One Behind initiative. Now, Doctor, how does LNOB help reach boys from underprivileged or marginalized communities?
Okay, so basically, when we talked about it before, it was the first phase where we went out. Now what we want to do is actually get the people that you trust the most to be involved in it.
Okay.
And that's the GP. Your general practitioner, your family physician in your community should be the person that you are able to go to. There's a lot of stigma.
Yeah.
As you know, around HPV, around sexual transmitted diseases, etc. So it's important that there's someone that you can trust, that you can talk to. If you're having symptoms, that you can go to without feeling that stigma, without feeling that fear about talking about it. So the second phase of Leaving No One Behind is doing that, is actually getting the GPs involved in it. Before we parachuted in as NCSM and did the vaccinations. Now we want your community to be involved in it. So how we're doing it is that we're offering subsidized vaccinations. So for girls, you still have the school program, which is ongoing. But for girls who are outside the school program, you can also go to your GPs.
Okay.
But what is important here is that for boys, you can go to your GPs for it. And so we have we have packages with the GPs. We are targeting again 300,000. We like that number, 300,000, with 3 packages. The first, of course, first is not subsidized, unfortunately, but it's those who are outside of the 9 to 14.
Okay.
So those who have missed out previously, the ages between 15 and 45 years old. So you can buy the HPV vaccines through your GPs. Then we have those which are partially subsidized. So you're looking at about, compared to the private sector, you're looking at about 40% to 50%, much lower than the private sector. And that's targeting 9 to 14 years old, girls and boys. And then we have that which is fully subsidized. And the fully subsidized for boys and girls, again from 9 to 14, but they're from the remote, rural, underprivileged communities who don't have access to it in schools. We're working with our stakeholders who are actually providing it free of charge.
Wow, that's great.
To these people.
And they really need them also.
Exactly. Exactly.
Now, what challenges do families face in accessing HPV vaccination and cervical cancer prevention services, and how does LNOB help close those gaps for boys and girls alike?
The first thing is that, what we want to do is to ensure equitable access. And that's important. There are a lot of people who haven't gone to schools or who might have dropped out of schools. And what is wonderful now is that the School National Program is actually previously was in, I think, 11-year-olds, and now they're dropping it down. So your standard 6, your standard 6 kids can get it, so that they actually stay within the school system. And able to get it. But what we're looking at is a wider framework of people. HPV, as I mentioned, has a stigma, which is, surrounded around it. And that stigma is really associated with the sexual aspect of getting HPV. And I'd like to be really, really clear here. We are not advocating. We are not promoting for the whole idea of free, uninhibited sexual contact in boys and girls. We are not doing that here.
Yes.
What we're looking at is a vaccination which can stop you from getting cancer.
Okay.
This is the only vaccination out there, that can stop you from getting cancer. And when has anybody heard, of, you can actually prevent cancer through vaccination. So that's important for people to know, but a lot of people don't realize that.
Yes.
And so that is one of the challenges that we have there, which is the limited awareness. Most parents, most caregivers are not aware of HPV. And if they're aware of HPV, they think, cervical cancer, so I'm just going to do it for the girls. I don't think about the boys. but it's important to look for the boys as well. Not just to protect the girls, but to protect the boys as well.
Yes.
That's incredibly important. The other thing, of course, in terms of the challenges you face is geographical.
Yes, getting to people.
Getting to people.
And people getting to the
to the
GPs or the
yes.
vaccines, right? Yeah.
So it's looking at manners that we can utilize, and that means it's really community.
Yes.
It's really community-based, getting out there in the community, and from your central GP, then you move out even further into the community, into those landscapes, the geographical areas that you can't reach. And that's where NCSN comes in as well.
I see.
We go out. We are able to mobilize communities and volunteers, etc., to go out, as I mentioned, on ships, on boats,
Yes.
everywhere, nooks and crannies of Malaysia.
Yeah,
We're willing to do it, but we need to do it with partners.
Correct.
So 300,000 over this year, boys and girls. I'm reaching out to everyone to realize that this is something that we can achieve. We can actually achieve cervical cancer elimination in Malaysia. And that's a WHO,
Yes.
program that that is being pushed globally, and Malaysia is actually on the cusp of being able to do that if we can increase the amount of vaccinations that we do.
Yes, that's right. Now, before we wrap up our conversation, I just want to take one more question from our TikTok right now. Someone asked, after taking the vaccine, is there a time before having intercourse? He said, does it take time to get into effect or something like that?
Of course, vaccines take a little time.
Okay.
For them to build the immunity. So, you're talking about 2 weeks, etc., to get your full immunity towards it. But yes, vaccines, do start working straight away.
Okay. They work straight away. So
Yes. Again, we're not advocating to have, unprotected intercourse and, it doesn't stop pregnancies, etc., etc. It just protects you against a virus that can cause cancer.
Now, doctor, how accessible are cervical cancer screening and HPV vaccination services in Malaysia, especially for undeserved communities?
Okay. Firstly, in terms of screening is actually doing checkups when you have no symptoms whatsoever.
Yep.
Okay. It's free of charge in public institutions. And NCSM, in collaboration with LPPKN, the National Population and Family Development Board, provides free DNA testing for underprivileged women. So it is very, very accessible out there. In terms of awareness, people are not coming forward for these free services because they're just not aware of it, or they don't think it's going to impact them.
Or it's going to affect them in any
Exactly.
way. Yeah, it's not relevant to them.
Exactly. But it is. As I mentioned right at the beginning, it's a very common virus. It's sexually transmitted, yes, but it's a very, very common virus. So any adult, who is sexually active can get HPV. So it's really, really important in terms of continuing that awareness, education, so that people realize that it's something that, one, you can prevent, two, you can find early. Again, as I mentioned, it takes a long time for HPV to cause cancer. So it has to be persistent.
Yep.
So you're talking about 10 years.
Wow, okay.
Before cancer actually occurs.
All right.
But in a way, that's good because it gives you that 10 years to check up.
Yes.
So even if you've had the vaccination, you should still continue to check up because remember, the vaccination doesn't cover you for everything.
Okay, so but let's say if someone already has HPV, but it hasn't become cancer, and then they go and get the vaccine?
You can still do that because remember, HPV might not persist.
Okay.
So HPV comes and goes. It's only that persists. So you might have an HPV infection today.
Okay.
You get a test, it shows HPV.
Okay.
In another 3 years, you go and get another HPV test, and it might show that you don't have HPV.
Okay.
And this is without vaccination because it comes and goes. It's just like the flu virus.
All right.
You
Okay.
get the flu, it goes away,
yes.
it comes back, it goes away, etc., etc. What we worry about is the persistent one, the ones which stay on. So the ones that stay on is what you are checking for when you do the screening. So if you know then you have that HPV virus, which is persistent, that every time you check, hey, that HPV virus is still there, those are the women or boys that you follow up, that you check more frequently to ensure that nothing else is happening to them.
Yes.
Vaccination, of course, even if you have the HPV virus, remember there's 200 different subtypes.
Yeah. Okay.
Okay, so even if you have the HPV, even if you have HPV, you can still get vaccinated because you will be covered for the other subtypes.
Yes, you're right.
So it still decreases your risk for developing a cancer.
So, yeah. Now, one final question before we wrap our conversation, Doctor. What is your key message to parents, caregivers, and the public about their role in supporting inclusive HPV vaccination efforts?
Number one, let's start talking about HPV. Let's
Yeah,
destigmatize
like what we are
it.
doing right now.
Exactly. Let's destigmatize it. You know, I know we don't talk much about sexual activity in Malaysia. It's not something that we talk about widely. But it's a normal function of men and women.
Yes, and
Okay, so we need to take it out of that closet or you know that basket that we don't talk about and start talking about it, because we can do things to alleviate the diseases that we can get, and especially cancer. Okay, and there's simple things that we can do: vaccination, screening, early detection. Message is, let's all come together.
Yeah.
And do something about it, both boys and girls. We're not just talking, yes, it's Cervical Cancer Month, and we're talking about protecting girls from cervical cancer, but let's talk about protecting both our girls and boys as well in the long run.
Yeah, in the long run. Doctor, thank you so much for your insight. Is there anything else you would like to add?
Go get vaccinated.
Yes, that's right. Go get vaccinated, okay? Especially parents, if you have, children and, you're not giving them like a green card or something. Go and do whatever you want. That's not what we meant. But prevention is always better than cure.
Exactly.
Yeah, and nowadays we see the world we are living in. We see what's happening in our society. So it's better to get them vaccinated, to get them protected before things get worse.
The last thing, if I can say, if I could plug, if you want more information about it,
yes, definitely.
we have a website, https at hpv.cancer.org.my. So that's hpv.cancer.org.my. Go into the website. You get a lot more information about it. You'll get a lot more information about HPV itself, about the Leaving No One Behind program, your GPs that you can go and see and talk to, etc., etc. Educate yourself.
Yes.
You know, empower yourself, I think, is the most important thing, is take your health in your hands, empower yourself, do something.
Yes, that's it. Thank you so much, Dato, for giving us all these insights. I believe many would have heard this and they would want to do something about it.
Great.
Yes. Now, yes, I was speaking to Dr. Saunthari Somasundaram, President of the National Cancer Society Malaysia, and we were talking about leaving no one behind. Now, of course, as she mentioned, HPV affects both males and females. It can lead to several types of cancer, and early vaccination is one of the most effective ways to prevent it. So, with initiatives like leaving no one behind, the goal is clear: equal protection, equal access, and a future with fewer HPV related cancers. Okay, so parents and caregivers listening in, HPV vaccination is recommended for children aged 9 to 14 before exposure to the virus, and it protects not just individuals but the wider community. So as Doctor mentioned just now, for more information on HPV, cervical cancer, and the LNOB program, you can visit hpv.cancer.org.my. Thank you once again to our guests from the National Cancer Society Malaysia, and thank you for tuning in. We got the news coming up in about 11 minutes, and then I'll be back after that for the third hour of Traxx Midday Buzz.